It's Cordelle Luces, and I am here with Mr. John here. I am getting consent to make a video and a YouTube link for an abdominal exam. Do you give consent, sir?
Yes, sir.
Alright, he has given consent. And the first thing we do is the inspection of the abdomen. So I'm just gonna pull this up and we're gonna look at his abdomen. So with inspection of the abdomen, we're looking at the abdomen, how it's shaped. We're looking to see if there's any lesions, if there's any surgical wounds, if there's any I would say there is present hair that's growing around him at his umbilicus and moving up to his chest. This is a sign of good tissue perfusion. The hair is black and fine, but it is not overgrowth. The second thing we would do is actually auscultate. So what we do for auscultation, we divide the 4 quadrants and the abdomen into 4, and we call it the upper, the right upper, left upper. We have the right lower and the left lower abdomen. So I'm going to auscultate the abdomen. Okay, and with that we auscultate with the diaphragm of the stethoscope, and we're checking just to see what would be the bowel sounds. Is it active, normal active, is it overactive? And in his case, I am actually going to start listening. Just breathe normal for me. All right, you can actually see the rise and fall of his chest with his breaths as well. And I'm going to listen with the bell now. Okay, so what I'm going to do, his bowel sounds are actually normal active in all 4 quadrants. I'm going to actually do vascular sounds. So I'm going to listen to your aorta, okay, to see if there's any bruise or trill, and it's going to be with diaphragm and the bell. Okay, so we're listening to his aorta. And currently there is no bruise. Okay, and then I'm going to listen to his iliac arteries and his renal arteries, just because there is a split. And then we're going to listen to his femoral artery, okay, which is a little lower. Okay. And I'm just going to repeat it with the bell. And the FEMS. Okay, so there's no bruise on examination of the vascular sounds. I'm going to move on to palpation. So I'm going to lightly palpate. If there's any tenderness in any of your quadrants, please let me know. So I'm going to palpate, light palpation. Okay, do you feel any tenderness or pain or discomfort? Okay. 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 So one of the things that I tell people as well, when I listened to his vascular songs, I also try to listen for when I did the 4 quadrants, try to listen to see if there was any rubbing or friction of your liver and spleen. There was none. Okay, I wanted to explain to you. So light palpation is to get your feeling of the skin get comfortable, see if there's tenderness, because you don't want to jump to deep palpation. So what I'm going to do is now I'm going to start deep palpation. Okay, and the deep palpation, I just want to actually, you know, feel here and, you know, make sure that we could, you know, palpate to see if their spleen is there and if I could feel it, and your liver, of course, if I could feel it, like if it's down, and any tenderness. Okay, all right. Also, I just want to feel to see if there's like a distendon of your aorta or malformation as well, and the iliac vascular, and of course if there's like any hernias or abnormalities that forming, any discomfort. So we do percussion, and with percussion what we do is we check to see if it goes from tympany or dullness. Now dullness is expected to be over the liver and if there's an enlarged spleen. Okay, so I'm going to start now. Okay, and please let me know, because what we're going to do here is really lightly tap. Okay, and then raise up my fingers are a little bit, so I want to see, and this is where I'm seeing the change for your liver. So I'll come back to finish with that, but I want to just want to see if I hear, and there was no dullness, but this is where with the rib cages, but there was no dullness over the liver. Now I just want to kind of palpate your liver, I mean over the spleen. I want to palpate to see where your liver is starting. Okay, and this is what we'll call like a kind of coffin to see where the liver is. Okay, all right, so I'm thinking where in between the rib cage to kind of decide what's the length. So it's about this length, and I just want to see how much cm. So it's about 7 cm. Okay, so that's the measurement of the liver. So what I want to do now is I want to actually do what we call a Murphy's sign, and Murphy's sign is to actually evaluate the gallbladder. All right, so I'm going to palpate and I'm going to ask you to breathe in, and please let me know if there's any tenderness. So take a deep breath in and out, and is there any tenderness there? So the Murphy sign is negative. If he had tenderness during this examination, we would be saying that he would have some form of inflammation or blockage that's causing the gallbladder to be inflamed, or it could be an infection that's present. I'm now going to be able to do an examination to evaluate for if you have appendicitis. So what the rebound sign is I'm going to actually put pressure and release, and you let me know if there's any tenderness, if there's any pain, discomfort. Is it better with the pressure or without the pressure? Okay, so this is where it would be, and then I release. Is it better? Any tenderness? So if he had tenderness when you press and when you release it gets better, then we will be concerned for some form of inflammation at the appendix, or it might be a sign for positive appendicitis. All right, and that's a rebound sign. Now, one of the things for checking to see if there's diaphragm inflammation, you would actually raise your leg, and you normally would raise it and put it in and out, and we would be able to identify if he had tenderness, and you could do the same on the other leg. Okay, and you could go in and out, and with that you'll be able to identify if there was some form of inflammation or appendicitis in the diaphragm area. All right, and that concludes this exam. Thank you, sir, for your time.